Hi folks, this is Dr. Rob CYWES, and in the work that I do, the carb addiction space, it's pretty easy to understand carbohydrates as an addictive drug and the removal, but when it comes to the replacement, the thing that we focus on to replace carbohydrates as a dysfunctional form of emotion management is to look at what we call effort-based emotion management systems. And it's the creative arts, it's the healthy human connections, it's the exercise, healthy sleeps, spirituality, meditation. And one of the big topics that we are least likely to talk about, and yet one of the most important aspects of healthy self-care, as our self-esteem, our self-confidence, and our self-respect grows, or as that remains in the toilet, is sex. One of the S's of the chess, CHESS, is sex and a healthy sexual relationship. So one of the things to understand is that sex in its rawest form is for procreation, and therefore there is huge pressure and value to sex as a species because it results in children, it results in procreation and survival of the species. So the biological reward for sex is an incredibly powerful, valuable thing called an orgasm. And that in its rawest form is a priority for a species. So anything that has huge benefit in terms of survival of the species and advancement of the species is going to have a powerful reward. Can you imagine if having babies had no benefit, at least to that person? We would have been gone as a species a long time ago. So that orgasm tremendously powerfully activates the endorphin system, and it can be a very useful experience that then has collateral benefit, or it can be misused to the point that is isolationistic, disruptive, and actually can become part of an addiction transfer. And in today's video, we are going to take on male sexuality. I've just done a video on female libido, female sexuality. Now we're going to talk about male sexuality. You know, just before we go ahead, one of the things that's always in my head is the protein sparing effect and how to promote adequate protein synthesis in the liver. Well, sometimes the human body uses protein to make sugar rather than to make proteins. And one of those is if you're at a glucose deficit, or if you're fat adapted at a ketone deficit, because some of those proteins, about 9 of them, actually when they get broken down by the liver, don't form sugar, they form ketones. So from time to time, if you've had a lean protein meal and you haven't eaten enough fat, popping something like this, ketone IQ, which is an exogenous ketone, will get you into ketosis very quickly, will restore your blood ketone levels, and then the protein that you've eaten will be used by your liver under the influence of insulin to make new protein, not to make sugar or to make ketones. Look at the show notes down below for a promo code to get 20% off. So the first thing to understand is that a lot of males who have addictions, without ever talking about it, without ever really exploring it, also simultaneously or in parallel have a very dysfunctional sexual relationship as well. A lot of pornography, a lot of damage. I don't mind it. I don't care about multiple partners. Absolutely fine. But when multiple partners, illicit multiple partners, disrupts healthy human relationships, that is dysfunctional. And when you are preying, when you are using your dysfunctional sexuality to prey on people, be they male or be they female, when you prey on them, when you victimize them, when you make them uncomfortable because of your sexual advances in the modern society, that is a dysfunctional form. And even though it may give you a buzz in the instant, it'll come back and bite you in the butt the next time. Not literally, but figuratively. So the point is that a lot of people who have addiction, by definition, their self-esteem, their self-confidence, their self-respect is in the toilet, and therefore their sexual respect of themselves and their ability to have healthy sexual relationships with themselves and with others is very dysfunctional. A lot of voyeurism, a lot of pornography, a lot of sexual exploitation, a variety of dysfunctions, and it's never spoken about. It's like, we don't talk about it. Well, folks, listen, pornography must be an issue if it's a multi-billion-dollar industry. And if you look at TikTok, if you look at Instagram, you look at some of the social media, the people that are getting the most hits are those sexy people, male and female, that are out there portraying and selling sex. Somebody's paying for it. Okay? Somebody's paying for it. And that can become very dysfunctional. It becomes a process addiction. So let's break this all down, because then there is individual performance. There's the diseases that go along with male sexual performance and the ability of libido and the ability to have sex functionally that is related to carbohydrate addiction. So let's start there. Okay? By definition, obesity and diabetes, which are the two major progenitor diseases. Out of that comes so many of the others, the cancers, the Alzheimer's, all those things. But the root cause there is insulin resistance. And insulin resistance is a very, very toxic process to the entire human body. Sugar damages every space in which it occurs, and insulin can also damage certain spaces. So from a purely functional perspective, especially more on our diabetic side where the nerves are injured more commonly, from a purely practical functional perspective, we see tremendous numbers of erectile dysfunction. We see ejaculation issues. We see some people who can get an erection but cannot have an orgasm, which are all disruptions of the parasympathetic and sympathetic injury to the parasympathetic and sympathetic nervous system. Then we see men with prostate disease, prostate cancer, having to have instrumentation of their prostate, which can also damage erectile function. And then we see problems with fertility, where you have low sperm count or you have damage to the sperm itself, and the sperm is abnormal and you're not able to have babies. And infertility, male infertility, is a huge problem associated with insulin resistance, obesity, and diabetes. And then for certain men who are androgenically fat, okay, the act of being able to be sexual is difficult. When you have difficulty accessing your penis, when there are body odors that are not pleasant, when you're not able to clean yourself adequately, all of those, or you have skin diseases, skin infections, rashes, yeast infections, those can be, I know it's horrible to talk about those, but we need to. Somebody needs to address these. Those are all tremendous liabilities in terms of healthy sexual relationship. Whether it's with yourself or with a partner, those can be very, very challenging. Those can be very, very challenging. That's just purely from the practical side, from the functional side. Then you have the psychological overtones of body image, of a sense of inadequacy, of a poor sense of self, where you're too shy to engage with a partner, or you become victim of certain partners. There are plenty of male and female partners that exploit the obese and control them and manipulate them in an undesirable, unwanted way. And the fat person is not capable sometimes of being able to say no, of being able to set boundaries. That can be very challenging. So there's a lot of psychosexual pathology that goes along with this. And developing a healthy sexual image, a healthy sexual habit, a healthy sexual relationship, first with yourself and then with your partner, is one of the most incredibly beneficial things that you can do as a male. So let's start with the practical part. First of all, there should be huge incentive, not necessarily to buffing your body to look like an Adonis, but at least to bring your health, your weight down to a level where you can function decently and where you feel attractive. You don't necessarily have to look like Arnold Schwarzenegger when he was Mr. Universe. But be as attractive as you can be. And secondly, by losing weight, Cleanliness becomes easier. I mean, think about this. The obese person that can't wipe their own ass, that has to sit down to go to the bathroom, that has to lift up their belly to even be able to access, let alone see, their genital organs. Those are all problematic. There's incentive to lose weight. If you have erectile dysfunction, if you've had diabetes and have erectile dysfunction irrespective of your weight, there are plenty of medical ways to support that. The Viagras, the Cialises, while they have a lot of cardiovascular negative effects, there's a risk of a heart attack or a stroke, they have huge benefit. And I don't get into that. I've kept that a little bit distant from my practice. I've not ventured into that arena, but I would refer people to some of the erectile dysfunction specialists who can help you with medications. Just don't be a victim. Some of those people are leveraging you for your money, and they know how desperate you are. Don't be a victim. Don't be a victim of those people. Go to someone legitimate who understands this, who's experienced in it, and is there to help you, not make money off you as a victim. And certainly don't buy into all these potions and powders and crap that is sold on the internet as having this thing. It's just people trying to rob you of your money. Those are just wallet biopsies. Stay the hell away from them, no matter how desperate you are. They do not work. Their only benefit is to rob you of your money and your self-esteem and your self-confidence and your own personal integrity. The second thing is psychologically. I understand the attraction that males have to the female form, to the female body. Perfectly fine, as long as you don't act on it in a way to cause anxiety in that female. Fine to look around, fine to check things out. But when it comes to you and yourself and you and a partner, male or female partner, if you are engaged in something long-term, now if you're on Grindr or on just looking for a sexual experience, we're going to leave that off right now, okay? That is absolutely fine from my perspective. Two consenting adults looking for a sexual experience. It's I'll say this, it's a come and go experience, okay? On the flip side, if you're looking for a relationship, don't start with the sex. Don't start with the sex. Start with a connection. Does she or he make me smile and laugh? Do they make me feel confident about myself? Do they build me up? Are they trying to victimize me? Are they trying to get something from me? And you don't want to have that almost narcissistic, everybody's out to get me. I have a relative that lives in a world of, she's just petrified that everybody's trying to take something from her, and it's just destroyed every relationship she's ever had, including the one she has with me. Be that as it may, build a relationship on mutual positivity, on mutual admiration, on mutual intellectual and fitting. At a core, at who I am as a human being, can I have that healthy relationship with you? And then over time, explore the physical side. Try not to begin with the physical. Try not to begin with the physical. Especially if you're still obese, if you still have erectile dysfunction. Form the relationship first. Because if she cares about you, if she likes you or even loves you as a human being, he or she, depending on the sex of the partner, doesn't matter, will then be much more tolerant of sexual limitations that you may have. And that's important. You don't want to hide that, but you don't want to put it up front. And for men, there are plenty of ways in which to make things work. But the psychological aspect is so important. Now, the next thing about men is, yes, men will watch some pornography. They will use that from a sexual stimulation perspective. No issue, no harm, no concern. But if you delve into that, if that's all you're doing, if you're spending hours and hours and hours looking at pornography. If you are so into pornography that you forsake getting into or managing or being part of another human relationship, that becomes very dysfunctional. If you are paying for sex on a regular basis, I have no problem. I've never done it. I'm never interested in it. I've never had to do it. It's not part of what I do. But if you want to pay for a sexual relationship from time to time, I'm not going to argue with that. But if that's where you live because you don't have the ability to develop sexual relationships, that's problematic. If it becomes a problem in your life, if you're getting arrested, if you are losing jobs because of it, if you're losing money because of it, that's problematic. And recognize it as such. It's difficult to recognize as such. But simple ways to look at that. Look, never, ever, ever, in my opinion, never, ever, ever spend money on pornography. Once you start spending money on pornography, then it's problematic. And again, this is an opinion of mine. Never, ever, ever spend money directly for sex. Never spend money for sex. Now, you can say, okay, if you're whining and dining somebody, that's kind of artificially spending money on sex. But that's actually spending money on a relationship. But never, the boundary for me is never spend money on sex, never spend money on pornography. Once you start to do that, I believe you're crossing a threshold. You're losing control. Just my opinion. We can argue about that. But obviously, a lot of people are spending money on it because the sex work industry is enormous, the escort industry is enormous, and the pornography industry is enormous in terms of dollars spent. Okay, the biggest TikTok stars and the biggest Instagram stars are people selling flesh. And that's problematic for me. Okay, I'm happy to argue that point. Don't demonize pornography at the same time. The religious zealots that are out there demonizing pornography, demonizing masturbation, demonizing self-sex. Nope, don't go down that road either. Okay? An orgasm is a wonderful, wonderful experience to have from time to time as part of healthy self-care. And as long as that relationship is healthy and does not have a bunch of guilt and negativity and self-recrimination overtones to it, it's absolutely healthy. But have it within a diversity of self-care. And sex may or may not be part of relationships you have with people. But if you're having a relationship with a partner, be comfortable about talking about your sexuality, about talking about your lack of libido. Yes, there are plenty of men out there who have very, very poor libido. But because it's part of masculinity, we don't talk about it, we don't own it, we don't share it. If you have a partner that you trust implicitly, as tough as it is, begin that conversation. Or connect with a therapist that can help you to talk about it first when you trust them in that safe space. Those guys can talk about sexuality, can talk about their sexual issues, limitations, physical or psychological, their libido. Talk to that with a professional therapist first. And in our practice, I'm very comfortable, as is Erin, our psychiatric nurse practitioner, talking about that. But learn to trust us so that you can explore it. We're not necessarily going to give you advice or guidance, but being able to practice the conversation first with a therapist then allows you to practice that conversation or to open up that conversation with a partner. If your libido is flat, if she wants or he wants sex with you and you're not comfortable, you're not up to it, have the conversation because it'll disrupt the relationship. It'll disrupt the relationship. We have my wife and I have a wonderful couple that we know very, very well. And both partners talk to us about the fact that they don't have a sexual relationship, but they've never talked to each other about it. That's a problem. Talk about it. See what the solution is. Figure it out. But if you're too ashamed, if you're keeping that inside, you're too ashamed, and you've always got an excuse about why you don't. And men have as much libidinal issues as the females do, but they never talk about it. And it may be a sense of inadequacy that prevents you from wanting to perform. Guys, talk about it, open up about it. But don't go and hide in some dark, steamy room with your pornography. Don't go and spend a ton of money on it. That's dysfunctional. And that is as much an addiction as carbohydrate addiction that makes you fat and sick, because it's dysfunctional. And Lord knows healthy relationships are the foundation upon which a healthy society is built. And if you have children, if you have kids, start talking about healthy sexuality with them. Not the nudge, nudge, wink, wink stuff. Yeah, that's fun. Joking about it is fun. But if you can open up and begin to talk to your children at an appropriate age about healthy sex and what those boundaries look like, you're creating a child who has confidence in sharing that. But if we don't talk to them about sexuality, if it's a taboo subject, if we don't talk about it, then they're developing anxieties and stresses, and they're learning it from places where they shouldn't be learning from the internet, from pornography, from sex, not from healthy sexuality. So men, begin the discussion. Talk about it. Talk about it. Feel comfortable talking to your partner, talking to us, talking to a therapist about it. Open up. Because a healthy sexual relationship, a healthy sexual experience is one of the most wonderful endorphin experiences you can have, whether things work well or not. But get there. If this has made you think I've done my job, but getting rid of insulin resistance is one of the healthiest functional ways, psychologically and physically, to advance healthy sexuality. And we can help with that, directly and indirectly. If you need help, if you want to talk, if you want to open up, if you need help, give us a shout. 561-517-0642. If you've enjoyed the content of this, if I've made you think, throw us $1 or $2. It's not a porn site, even though we talked about sexuality. So the money you're throwing at us is not the same as some, what's it called, MyFans or, what's it called, James? OnlyFans. Okay, sorry. You see, James knows. The OnlyFans account. That's what it is. No. You're not throwing money there. But hit us up. The PayPal account, the Patreon account is down below. Just throw us a few dollars. But I am the Carb Addiction doc, and we need to talk about this.